Hi, I'm John Denison, and I'd like to welcome you to the Vantage Health and Wellness Senior Educational Series session. Today, I'll be recapping a recent live session on preparing for end-of-life care, brought to us by Dr. Charles Mason, our resident hospitalist. You need to know that you have an opportunity to decide what you want for yourself regarding your end-of-life care before the unfortunate happens. During times of illness, you may not be able to make decisions for yourself. Who do you want to speak for you? What decisions would you like them to make for you? Do they know your wishes and your values? While beginning to plan for your end-of-life care, you should take the time to discuss these matters with your spouse, your family, and even your close friends. There are several steps to preparing for end-of-life care, and the first step is to assign a loved one the power of attorney. Now, a power of attorney gives a specific person the authority to make decisions on all legal and financial matters when you cannot. It also gives them the authority to make decisions regarding your medical care, should you become unable to make decisions, if it specifically states medical power of attorney. You may have two or more people as your power of attorney, and you may designate the priority in which they can be given authority should one of them be unable to because of physical or emotional reasons. An easy way to assign medical power of attorney in Louisiana is to use the 5 Wishes form found at agingwithdignity.org. Now, this form can be printed off the internet or located at your local Council on Aging and stands as one of the easier ways to assign a medical power of attorney. Now, one thing to be cautious of, it is possible to have a lawyer create a power of attorney but fail to assign proper medical power of attorney due to a mistake in the legal wording of the document. The 5 Wishes document will enable you to make the best possible decisions regarding your end-of-life care. If there is no power of attorney, Louisiana has a hierarchy order in deciding a surrogate decision maker. Court order naming someone, very unusual. Written power of attorney, spouse, adult children, parents living and able, adult siblings, predecessors and descendants, grandparents is the same. Majority vote, Unfriended Patient Act, which allows for friends to be a part of the decision-making, and attending physician, if so willing. A very common form regarding your end-of-life care is called a DNR, or a Do Not Resuscitate. Basically, if you're sick or your heart stops beating or you stop breathing, the medical facility will not restart your heart and breathing. However, this does not mean the medical facility will prevent treatment or travel to a hospital during an emergency. You can pick and choose the treatments you would like performed. One such option is comfort care, which allows all treatment focused on making you comfortable despite illness. Another option is to allow for a restart after heart failure, but if your quality of life would be diminished, you allow the medical facility to withdraw treatment. There is legally no difference in withdrawing treatment versus not starting treatment. Other very important forms that may be used during end-of-life care are the LA Post form and a living will or advance directive. LA Post can only be used with an estimated 6 months or less to live, and it must be filled out with a doctor. A nurse, nurse practitioner, or other person may not fill it out. The doctor and patient will both sign the form, and you must keep a physical copy with you. This form grants the doctor immunity if someone challenges the decisions on the form. A living will or advance directive is a written statement detailing a person's desires regarding their medical treatment in circumstances in which they are no longer able to express informed consent. It is recommended that this procedure should be discussed with a social worker or doctor, and Louisiana law dictates specific wording for these forms. Lastly, during end-of-life care, you may encounter a time where hospice or palliative care is needed. This type of care usually occurs with patients that have 6 months or less to live. While hospice is palliative care, all palliative care is not hospice. Palliative care is specialized medical care for people with serious illness. It focuses on providing relief from the symptoms and stress of a serious illness. The goal of palliative care is to improve the quality of life for both the patient and family. Most families express that hospice is a positive experience, and it allows the patient and family to choose not to suffer at the end of life. It also will allow a patient to be at home in a comfortable setting. Inpatient hospice is also possible. A patient may not need or want hospice care after a first diagnosis and can instead choose palliative care. You may ask for a palliative care consult at a hospital at any time. Medicare can cover palliative care, but only to a certain degree. An advanced planning discussion is recommended to have with a doctor, and it is possible to meet with a doctor in an instance where they are paid for their time. Remember, it is tough to make decisions about end-of-life care. It takes time and many conversations with loved ones to reach a point of comfort with these decisions. At Vantage Health Plan and Affinity Health Group, we want to make sure you are fully informed and fully aware of all your options for end-of-life care. If you have any further questions, please speak with your doctor or primary care physician. And for more information on upcoming Senior Educational Series events, please call 855-301-5198.